To Chairman Isaacson and Ranking Member Tester, thank you so much for the invitation today so that I can advocate for S-123, the Ensuring Quality Care for Our Veterans Act. I also want to thank you, Senator Bozeman, as well as a member of this committee, and for also supporting S-123, as well as Senator Grassley and Senator Kuhn. So thank you very much for your support on this issue. And today, folks, I want to share a story of Anthony, who is an Iowa veteran. In 2017, Anthony was experiencing headaches, so he went to the Iowa City VA Medical Center to get an MRI of his head and neck. Anthony's MRI results came back, and they unfortunately indicated that he had a brain tumor. Anthony was referred to Dr. John Schneider, a neurosurgeon at the Iowa City VA. Anthony was struck by Dr. Schneider's demeanor. He was personable and genuinely seemed to care about Anthony's well-being. Dr. Schneider was going to operate on Anthony with the goal of removing the tumor, and Anthony was confident he was in good hands. After Anthony's surgery, Dr. Schneider proclaimed that he had removed all of the tumor, all of the tumor. In the weeks and months following the surgery, it became clear to Anthony that something was amiss. His health hadn't improved, and when Anthony would bring this up to Dr. Schneider, Schneider claimed that it would take at least a year for his symptoms to improve. All of this changed on December 3rd, 2017. A disturbing report in USA Today found that the VA had knowingly hired providers with revoked medical licenses and who have a history of providing substandard care. One of those providers was Dr. Schneider. After that report broke, Anthony immediately went to the VA and had another MRI. It turned out that Dr. Schneider had never removed the tumor. Members of the committee, Dr. Schneider never should have been hired to treat our veterans. While the VA reformed its hiring practices, thank goodness, there are still veterans out there who were treated by physicians with revoked licenses, but who don't know if they received bad care. That's absolutely unacceptable. Every veteran who was treated by a physician with a revoked license should have their medical care scrutinized by a neutral third party. That's exactly what my bill does. The Ensuring Quality Care for Our Veterans Act ensures that every provider who is hired with a revoked license will have their care scrutinized by a neutral third party. If that third party determines that the care was substandard, the veterans will be notified. The VA conducted a review of all their providers and found a small number of providers who were hired with revoked licenses. This bill focuses on that small group of providers. It's a targeted oversight measure with minimal costs that will give our veterans peace of mind. I thank the committee again for the opportunity to testify in front of you today, and I do urge the committee to support this bill. Thank you.